Mom deserves the best, and there's no better place to shop for Mother's Day than Whole Foods Market. They're your destination for unbeatable savings, from premium gifts to show-stopping flowers and irresistible desserts. Start by saving 33% with Prime on all body care and candles. Then get a 15-stem bunch of tulips for just $9.99 each with Prime. Round out Mom's menu with festive rosé, irresistible berry chantilly cake, and more special treats. Come celebrate Mother's Day at Whole Foods Market.
Today on CityCast Houston, we're celebrating one of our most important professions in Houston this week, nurses. But beyond the celebrations are major issues the profession is facing. So in honor of National Nurses Week, I'm talking to Rama Walker, RN and Chief Nursing Officer at Nurseify, to learn about the side of nursing that isn't always discussed. It's Thursday, May 9th. I'm Raheel Ramzanali, and here's what Houston's talking about. Rama, welcome into CityCast Houston. How are you?
I am doing well. How are you?
I'm doing all right. I want to start off by wishing you a happy Nurses Appreciation Week. I know y'all are celebrating all week long. What's the perfect gift to give to a nurse, by the way?
I would say gift cards. They love gift cards.
Okay.
Scrubs are also very popular. Whatever you do, don't give pizza. So,
Yeah, I'm sure y'all are tired of eating cold pizza because you never have time to eat, right? Rama, I want to go into this story I saw, which is so wild, right? In Florida, there was a nursing school where it got shut down because they found out they gave 7,600 fake nursing diplomas. And some of those nurses actually ended up in Texas. That was absolutely wild. As a nurse, what did you think of this? Because I'm wondering, like, when you work with some of these nurses, are they even able to perform their job if they didn't even go to an actual school and more of a quote unquote diploma mill? Like, what is that like?
so I was just as shocked as everyone else when we saw that. We have a group chat with my nursing school friends, and we were just like, how did this happen? So I honestly believe it probably was more an accreditation issue. Like the nurses probably still got the training that they were supposed to get, but because they weren't accredited, it technically didn't count. Because you cannot go through nursing school and pass your NCLEX if you didn't learn anything.
Mm.
So I will say that. But it was shocking that they let this go on for so long. Like, where are the checks and balances? I feel like I had to jump through so many hoops, first of all, through nursing school, constantly validating who I was and what I was doing. So I'm like, Florida needs to be investigated because what is going on?
It's Florida.
It's a Florida thing.
Florida's different. It's Florida. I know when you're at work and you see some of these nurses, they can't even draw an IV correctly. You're just like, did you go to that school? Are you part of the 7,600?
Like, where did you get your degree from?
Come on. Rama, you've been a nurse for such a long time, and I know you've seen some crazy stuff. So before we jump into the very important stuff and serious stuff, what's been the wildest stuff you've seen as a nurse regarding the profession right now?
I will say this is serious, but also very wild. I don't think people realize the type of abuse, I would say, that nurses face, especially in the ER. And I worked in departments where we were close or had a lot of homeless patients that would come in. So that's always like a very challenging space. You know, you have your frequent flyers, and essentially they just want somewhere to rest or get some food, um, and not necessarily always having a clinical issue. And sometimes that turns into violent situations where you have to almost like protect yourself. So I think those are the craziest instances that I've seen. There's just so much that happens day in, day out. And I think the craziest part about it is literally going from one patient's room who threatened to choke you, and then you have another patient who you have to give terrible news to, and you don't have that transition time to like even deal with and process what just happened in the first room. And now here you are in the next room.
Oh my
So
gosh.
it's a challenge. I don't think it's something that people process. You know, we have varying things that we're dealing with all at once and don't necessarily get that time to switch and take a breath.
So, I mean, being a nurse, just talking about that is stressful enough, right? And you, as the chief nursing officer for Nurseify, you are on top of what the nursing profession is going through, what they're feeling, especially here in the city of Houston, right? We've got the medical center, which averages 10 million patient encounters per year, 180,000 annual surgeries, 750,000 ER visits per year. What is it like for these nurses who are already dealing with the stress of working in this profession, but then you add one of the world's biggest medical centers on top of that? Like, what is it like working there?
I think what we've learned is to try to incorporate wellness and self-care. And so you can't change the environment. You can't change the volume of the patients. But I think what nurses are really realizing is that they have to prioritize themselves and making sure that they're presenting to work. So the challenges that you face, we are fortunate in the medical center and here in Houston, particularly, to have such a robust patient group because the medical center attracts people from all over. We have actually the benefit of experience. It could be taken good or bad, but we see such a big variety of cases from all over the world, essentially. In addition to that, I think another challenge that comes into it, which is really a great benefit for nurses, is having the diversity in the medical center, the different types of patients, the cultural sensitivity that you have to have, and we have so many different type of providers. So the stress is there for sure, but I think for nurses who are passionate about the environment and what they do, we're at a spot where they've kind of figured it out, like balancing what they love to do the most and not being overworked.
What are some challenges that nurses face here in the city of Houston that our listeners would be surprised to learn about?
I've been hearing a lot about nurses who are trying to transition from different specialties. As many opportunities as there are out there, that can still be difficult to navigate for nurses trying to figure out, let's say you are a med surg nurse and now you want to go into oncology. Although it seems like the mecca of specialties, going from one area to the next can be really difficult. And I think that's something that we need to raise awareness about, especially in an area that people would assume, oh, well, you work in a facility that has all these different, specialties. You should be able to just cross over and get different experience. But that has been a challenge. A challenge also is staffing, and that's everywhere. But um, having adequate staffing in the different departments. For me, just thinking about how much access we have, why should that still be a problem?
Yeah, that is so strange. So, with staffing, are there enough nurses right now, or is it nurses can't find enough work?
There's a little bit of everything. I think nurses are wanting more robust options as far as compensation is concerned. So it's very competitive when it comes to that. There is a shortage for sure of nurses to go around. So it's essentially robbing Peter to pay Paul. Um, and at this point, the pandemic, with the contracts and the travel nursing and all that has come about, and nurses realizing that they can do more with their degree, graduate nurses coming into the field, not really staying at the bedside as long as we did when I was in nursing school. So now they may stay 1 to 2 years at the bedside and they decide to go back to school, which is a great thing. But then the turnover, it's hard to keep up from a feeding the hospital standpoint. So these are challenges that are just ongoing. And then on the back end, just if I can add outside of the hospital system, from a nursing school standpoint, we don't have enough professors. We
Oh,
don't have enough capacity. So there are hundreds of applicants, you know, being turned away every semester because they don't have the capacity to accept the students who actually want to come into nursing.
yeah, I didn't know that. Are professors just retiring? Are they just swamped? Why don't they have enough professors? Because that seems like a great opportunity to teach and be part of a university. So I would always assume there's enough professors.
So the requirements for being a professor, you need a graduate degree, right? So there are really strong nurses out there, in my humble opinion, who would make great clinical professors, who would be able to really support these nurses. But the barrier is they don't have a master's degree or they don't have their PhD. And so once you add maybe an additional 5, 6 years to someone's career path, it doesn't become that appealing for me. Like at this point, it's like, okay, I've put in 10, 15 years into the nursing profession. I do want to teach, but do I want to go back to school? Not necessarily. So just kind of thinking, I'm really a proponent for being more creative in how we support the nursing programs as far as what other requirements are. Maybe there's a different way to assess clinical ability and knowledge outside of you going back to get your master's.
I want to go back to something that you mentioned about traveling nurses, right? Did that phenomena just really take off during COVID? Because I remember the stories. I have friends who are nurses, and let me tell you, Rama, they were balling out as traveling nurses, right? Like they were making it. And now has that slowed down, or is that still a big thing? And how much does the traveling nurse industry impact our industry here in the medical center and surrounding areas?
So, there's two sides to every coin. Obviously, I'm going to support nurses getting in their bag, getting their compensation, whatever it is that they need to get. So, at the time of COVID, there was a lot of federal funding and funding from local governments to support the influx of staffing and that high rate of pay. Not to say that these hospitals are not making a lot of money, so don't get that confused.
Oh, they are.
But the support, making that quick switch to bringing an influx of nurses to a very important cause, right? We had nurses on the front line who were getting sick, who were losing their lives, who were losing family members. And so there had to be a way to quickly replace that staffing. So definitely not the same environment as back when COVID was at its peak, but it's still a thing, right? Um, Travel nursing and temporary staffing is always going to be there because no matter what, your unit is going to go through ebbs and flows. You're going to have, high volume times. You're going to have people that are having babies or go out on PTO and things of that nature. So you're going to need that. But as far as what it was before, do I think it's going to go back there? Probably not. From a culture standpoint, I can understand the hospital wanting to move away from travel nursing because they don't have that camaraderie within the unit. They're there for a purpose, take care of the patients, go home. Some travel nurses are really good about trying to incorporate themselves into the department, but there are a good number who are just like, I'm here to make my money, take care of the patient, and I'm out. So, and it also causes a little bit of drama or, issues on the unit because you see people coming into your department who are making 2, maybe 3 times as you are doing the same work. And so the nurses feel a little slighted, like, hey, I'm already here. Why can't I get compensated, at this level? And you're bringing in people from other states, other cities to support my department. So it's a very touchy subject, and I've been on both sides of it. Being on the administrative side and also being a clinician, you get both sides of the story.
Many of us have those stubborn pounds that seem impossible to lose, no matter how good we eat or how hard we work out. My solution is PlushCare. PlushCare is a leading telehealth provider with doctors who are there for you day and night to partner with you in your weight loss journey. They can prescribe FDA-approved weight loss medications like Wegovy and Zepbound for those who qualify. Plus, they accept most insurance plans. To get started, visit plushcare.com/weightloss. That's plushcare.com/weightloss.
Your brain needs support, and new Ollie Brainy Chews are a delightful way to take care of your cognitive health. Made with scientifically backed ingredients like Thai ginger, L-theanine, and caffeine, Brainy Chews support healthy brain function and help you find your focus, stay chill, or get energized. Be kind to your mind and get these nootropic chews at ollie.com. That's OLLY.com. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
So with COVID, how scary was the pandemic for you? Because we saw all of the footage, right, coming out of hospitals, just how terrifying it was, how deadly it was. And being on the front lines, you saw the worst of the worst. You saw patients passing away. You've seen nurses pass away. And I'm sure, like all of us, we just wanted to be home and away from danger. How hard was the pandemic on not only you, but also your fellow colleagues?
It was very stressful, to say the least. If you think about what a hospital needs to function, a big part of that is supplies. And so when the world is told, stop working, that impacted our ability to keep ourselves safe. So I'm just going to start there. PPE all of a sudden was like very rare. And then when we're getting information at the same time as the public is, we don't have enough time to digest it, implement it make sense. So one day, we're all hearing no need to wear a mask, just keep your distance. Another time we're being told you have to quarantine for X amount of days. Oh, but wait, never mind, only quarantine for this amount of days. So it's like, didn't know how is COVID really transmitted. So the same questions that the public had, we had the same questions. So the fear was there. And so in trying to keep the staff calm, we also had a huge responsibility of not scaring our patients as well and managing that. And so lots of emotions, lots of breakdowns in the unit, just trying to make sure that everyone felt heard. There was a lot of panic when supplies came in. It's like, okay, wait, is there COVID on here? Like, are we supposed to disinfect it? Just trying to protect yourself while still caring for the patients. So it was a very challenging time. And then we did get to a point where we had, a lot more structure. There was, lots of communication going out. And sometimes by the time you delivered that communication, it changed again. So you just have to imagine you're sitting at home hearing all the different guidelines. We're actually having to get in our cars and go face this, without having a clear idea of what's the proper way to protect yourself. And it went beyond just the nurses. The lab struggled with how do they manage the specimens. And now you bringing EVS. Those are the people that clean our rooms and disinfect everything. And so they're scared. Like, I'm supposed to clean what is contaminated. Like, how does that impact me? What am I taking home to my family? So it was a very tumultuous time. And then you add on top of that, people actually getting exposed, getting sick, your coworkers getting intubated in the ER, seeing, patients being intubated, losing their lives, not knowing how to go home and care for themselves, family members who lived in homes where they didn't have the option to quarantine. So you tell a multi-generational family, okay, grandma's sick, we need to quarantine her, but like 5 of us share this bedroom. What do we do at that point? The person who brings home the bacon is now sick with COVID, told that they can't go back to work. What does the family do? So it was just not only our us taking care of the patients physically, but there was an emotional aspect to it. Yeah, it was a lot.
And then on top of that, I remember seeing reports that addiction also rose during that time amongst nurses, right? Like nurses have already had issues with drugs and alcohol because of the stress that y'all are going through, right? There's been reports that up to 20% deal with some type of addiction, but that number shot up during the pandemic. So what was that like, trying to take care of your fellow workers, your family?
Yep. Definitely heard a lot of heartbreaking stories. We had a couple of cases of suicide. The pressure just was overwhelming, for everyone. And obviously with increased stressors, you have self-medication happening. And so not surprising, but of course, psych was at the forefront and very challenging. And then the anxiety, I mean, outside of people being pushed as far as addiction, but people now developing these new symptoms of anxiety and depression, um, and just stress and worry because, we started the pandemic with like people losing their jobs. Even at the hospital, a lot of us weren't laid off, but there was, some furloughing happening. So it's like your hours are cut significantly. And then all of a sudden, COVID was spreading. And so now it's like everybody come back to work. So that uncertainty in itself can make or break you as a person. But now relationships are falling apart. People don't have the resources to go from two incomes to one income. And I had nurses who were affected by that. They had those concerns like, what am I going to do? Um, my husband just lost his job. And so now you're having to soothe these nurses and give them resources and trying to balance giving them time off to take care of their personal business, but yet the demands of the facility are still there, the patient needs are still there. So trying to be sensitive to what they have going on at home while still trying to serve the community and making sure you have enough staff and resources to care for what's going on. So it's a very delicate balance, a very challenging time that we were in.
I know this is something you deal with as the chief nursing officer, right? With Nurseify, providing resources, being on top of what nurses are going through. So just in general, like, how do nurses cope with all of this, right? Like, forget the pandemic, that's a whole different beast, but
Yeah.
the everyday stressors of taking care of somebody, seeing that patient you've developed a relationship with might pass away, right? The family angle, everything that you've laid out already. How do you just normally cope with all that?
We made it a point to give nurses an outlet, and giving them an opportunity, simply just being able to huddle post a death in the facility or a patient that we transferred that didn't make it, just talking it out, that next morning or at the end of the shift, giving them the opportunity to cry if needed and just being able to purge that, but also highlighting the resources that are available to them. Most hospitals do have access to therapists and things of that nature through their insurance. But as from a Nurseify standpoint, what we really try to do is connect the dots for the nurses, pointing them to therapists that we've worked with personally. We actually have a nurse turned therapist who does presentations on identifying some of these symptoms, because as a clinician, you're just kind of going and you're not thinking, well, I haven't eaten and I don't sleep well, and you're not really putting two and two together that you are now a patient yourself. And so just purely putting it out there for conversation, creating that safe space for those conversations is definitely the first step that we've taken, but also just pointing them to resources to have free access to just consultations and things of that nature, promoting wellness, promoting self-care, and just giving them the understanding that it's okay that you're not okay.
Yeah.
We actually work with someone who that was her term. It's okay to not be okay. And just that validation alone has done so much for us.
Do you think these big institutions are doing a good enough job with the emotional and mental health of nurses? I know you're making it a point, and I know other nurses are and administration is, but what about these big institutions?
I think there's an opportunity there, if I'm going to be honest, to figure out a way to get down to the root of the problem. I think sometimes a blanket solution could be, providing a free meal for that day or doing a fun activity, but we're not really getting down to the root cause or the root issue. And outside of the pandemic, there are some nursing issues that still remain. There's still nurse bullying. Nurses eat their young. That culture is still very prominent in the nursing community. And I think institutions really have to stop. And there's a lot of work happening, but there's still a lot of work to be done regarding that. Making it a priority that matters, because ultimately, the better your nurses are emotionally and mentally, physically, the better care your patients receive. It's a full circle.
Yeah. Okay, I'm glad you brought up bullying, okay, because I just saw that MD Anderson story where one of the doctors has been bullying staff members with verbal abuse at a point where they had to get emergency mental health treatment. So you're telling me that there's bullying going on within the nurses department as well. Like, tell me about that and what kind of environment does that create? I'm sure it's super hostile.
Absolutely. And as a leader, if you're listening as a nursing leader, if you know that this is going on, you have a responsibility to make sure that that's a no tolerance behavior. Um, but essentially, what it could look like, it could come down to different aspects of what nurses desire in the unit, which essentially would be like a ideal schedule. So that causes a lot of friction, like people getting certain days off or wanting a certain type of schedule or certain shift. Um, New nurses coming on, the salary gap causes a lot of issues once people become aware that, hey, this new grad just got here and okay, well, when I was in nursing school or when I first got here, it was really tough for me. So I'm just going to make it just as hard for you. It's crazy, but that happens. Um, and so when you realize that that's going on, that's something that you have to address head on. You can't like dance around it. If you know who the culprit is, bring them in and rectify the behavior. But yeah, it's unfortunate. And as far as the physician bullying, I've seen that. I haven't personally had it recently, but I can recall when I first started, I was in this clinic and there was this physician. He was just like, you know, angry and always demanding things. And I had to put him to the side. I'm like, listen, we're on the same team here. And I cannot support you if you feel like you have to talk down to me. And after that, we were like the best of friends. And I think people behave that way out of fear. So, you have a new person coming in, you're afraid that they may not get you or work well with you. And so your reaction is to like scare them off so that you can get your favorite nurse who you've been working with for 15 years. And I'm just like, now I'm going to be your favorite nurse because what we're not going to do is try to belittle me in this environment.
Rama, before we let you go, tell me more about Nurseify because this is super interesting.
So we are an on-demand staffing platform for nurses. Our goal is to be the most nurse-friendly company in the world. We want to give nurses the opportunity and flexibility to work how they want and when they want. Additionally, we have a passion for supporting the nursing workforce from the beginning, meaning supporting the nursing programs and all through their career, helping them decide if they want to engage a side hustle, work their gig assignments. And that's really what we stand for. We just want to make sure the nurses are heard, supported. We constantly have events. So I'm going to just do a shameless plug here. I know you said Nurses Week earlier, but we are celebrating Nurses Month.
Okay.
The whole entire month of May. So if you are in the Houston area, we have a whole calendar of events that we would love for you to engage with us and just kind of feel our culture, feel our vibe. Yeah.
That's awesome. So basically, y'all are like the Uber of nurses, right? Like
Yeah.
nurses can get on and be like, hey, I'm going to go work this opening right now.
Yep. I like to say we're the Match.com for nurses.
Match.com is better. Okay.
So anybody who needs a nurse can create a profile on our platform and all the nurses can create their profiles and they're like, will this work for me? So as a nurse director coming out of the hospital, one of the biggest pain points for me getting travel nurses or agency nurses is there was no transparency. I didn't know who I was getting, when they were coming, what their accolades were. I trusted that they were vetted properly, but I would have loved to at least get that information. And from the travel nurse side, they also have, some pain points where sometimes they don't have the full picture of what their assignment entails. And so we're trying to eliminate that from the industry and giving that transparency so that both sides know what they're getting themselves into.
Rama, thank you so much for all this information, this insightful conversation, and we'll talk to you down the road.
I appreciate it. You guys have a good one.
That was Rama Walker. You can learn more about Nurseify with the link in our show notes. Also, I want to send some love to all of our teachers who are listening for Teacher Appreciation Week. We truly thank you for everything you do. And before we go, I wanted to give you a quick news update. As of yesterday morning, HPD Chief Troy Finner has resigned after working 34 years for HPD. This news comes on the heels of the investigation into more than 264,000 suspended cases the department uncovered earlier this year. We'll have a more in-depth breakdown on Finner's sudden resignation tomorrow on our news roundup, so make sure you tune in. That will do it for today. Thank you for listening, and I hope you learned something new.
seeing like a trying to reconnect. I don't know if that's on my end.
No, you're still good. Yeah, it'll
Okay.
randomly do that. No worries.
Okay.
Yeah.